In this session, we are demonstrating, how to make covered stent when covered stent is not available in cath lab. Okay, so now we'll show you what are the things you need to make covered stent. So you can show here. So you need basically stents, which are which fit into the artery size. Okay, so in this I'm using 3mm stent, which is the most common stent which we use in epicardial coronaries. So you need two stents with a different length. So the idea is here you have two stents. One is 16mm, another is 28mm stent. So 16mm stent is used as covering layer, and 28mm stent is used as inner stent to deploy the 16mm. So which I'll demonstrate now. You can wait. Four. Yeah, now you can see this is 3 16mm stent. So what we did is we fully inflated it. You can take close shot. So fully inflated it, and so what essentially the stent as well as the balloon underneath the stent. This balloon material acts as covered portion of the stent, and this stent is the outer contour of your covering. So what we are doing now, we are just cutting this balloon on either side of the stent. Okay, so we cut this balloon on either side of the stent. Now we can remove the central lumen. So central lumen is removed. Now you have balloon along with the stent here. Okay, so now what we'll do, so where is the next stent? So the stent, so longer than your covered stent size. So this is the longest stent, and introduce this longer stent. So introduce your longest stent onto this stent, and now this acts as a covered stent. So you can crimp your outer stent on the inner. Okay, so now covered stent is done for us. So this acts as a covered stent. So what you can do, you can introduce this on your PTCA wire. You can introduce this on your PTCA wire, and you take it to the target lesion, where you want to deploy. But what you have to make sure is, so the covered portion is only the outer stent. This is something which you have to keep in your mind. So here it is 16mm, inner is 28mm. So your perforation should be covered by outer stent, that is the shorter stent. Okay, so you cover the perforation with shorter stent and just deploy. Yeah, so you deploy. So, and once it is deployed, yes, you can come back. So you can deflate balloon and you can come out. So now you can see, so clearly it is covered. Okay.